Hi, my name is Calvin Teo Jia Han, a fourth-year medical student. Last summer, I completed a research under the supervision of Dr. Gerard Flaherty, and this is the topic of my research. So nowadays, everyone is traveling around, and that includes patients with complex medical comorbidities, and that could be a risk for themselves. Say if they travel for a protracted period to remote destination, often with limited access to high-quality medical care, and there is also a risk of interactions between travelers' medications. For example, drugs used for malaria chemoprophylaxis and prevention of travelers' diarrhea must be considered by travel health practitioners. The published literature on this subject is limited, and few descriptions are available of the true health burden of international travelers. The aim of this research is to characterize the profile of pre-existing medical conditions and current medications among a cohort of travelers seeking pre-travel health advice and medical preparation in a specialized travel medicine clinical setting. So for this research, a retrospective analysis was done. I looked through records of travelers attending Tropical Medical Bureau Clinic in between the years 2008 and 2014. Any patient with a documented medical and medication history is recorded and analyzed by using IBM SPSS statistics program. And this is a sample of a pre-travel patient record in which the patient will have to fill in prior to consultation. Patients would have to identify the medical condition that they have, and they may provide any additional information such as past or current medical problems and prescribed medications. So I looked through 4,817 records and found that 56% of the patients had a positive past medical history. And of the 2,702 patients with a positive past medical history, 68.1% of the patients had only one medical comorbidity, and 31.9% of the patients had more than one medical comorbidities. And of the 2,702 patients with positive past medical history, 56% of the patients were on at least one prescribed medication. The median age of travelers is 28 years old, and we have also found that the majority of the patients are female at 67.4%. Most of the patients would visit a clinic 40 days before departure, and the mean number of travelers traveling in a group is 4.5. A majority of the patients travel for less than 4 weeks at 58%. 28.1% of the patients travel for less than 2 weeks, and 29.9% of the patients travel for 2 to 4 weeks, and 42% of patients travel for more than 4 weeks. The most common purpose of travel is holiday at 58%, followed by assignment 10%, business 7%, and trekking 3%. However, 22% of patients had multiple purpose of travel. A majority of the patients stayed at more than one type of accommodations at 35%. And the most common accommodation stayed by a traveler is hotel at 34%, followed by hostel 19%, and 9% of the patients stayed in other kind of accommodation. 2% of the patients went camping, and 1% of the patients traveled by cruise. And most of the patients only travel to one region at 62.1%. And the most common single country visited by patients is Southeast Asia at 17.7%. This is then followed by South America at 10.3% and Eastern Africa at 6.9%. And there are also a lot of patients who travel to multiple regions. 25.3% of patients travel to 2 regions, 9.3% of patients travel to 3 regions, and 2.1% of the patients travel to 4 regions. As for the past medical history, hay fever is the most commonly reported medical condition by patients at 23.6%. This is followed by allergies at 20%. And the most common type of allergy is penicillin allergy at 6%, followed by other drugs 4.5%, and environmental triggers at 5.7%. Asthma is the most common respiratory disease at 18%, followed by pneumonia 0.4%, and previous tuberculosis at 0.3%. 345 patients had a cardiovascular disease, of which the most common is varicose vein at 6.3%, hypertension 2.9%, and dyslipidemia at 2.3%. 15.4% of patients reported having insect bite sensitivity, and 5% of the patient had a photosensitivity. And 4.1% of patients had a psychiatric disorder, of which the most common was depression at 2.7%, followed by anxiety at 0.8%. 73 patients reported having previous surgery, and 59 patients has a thyroid disease. 2.1% of patients had previous infectious jaundice, musculoskeletal disorders, and neurological disease. The most common neurological disease is migraine at 0.9% and epilepsy at 0.8%. 1.9% of the patient had a skin condition, 1.7% of the patient has a gastrointestinal disease, and 1.7% of the patient had previous tropical infections, including malaria at 0.1%. And the most common reproductive issue reported by patient is polycystic ovarian syndrome at 0.4%, followed by endometriosis at 0.2%. And 11 patients were pregnant during their travel. 30 patients reported having diabetes mellitus, of which 10 patients had type 1 diabetes and 5 patients has type 2 diabetes. Unfortunately, 15 patients did not specify what type of diabetes mellitus that they have. And 1% of the patient had an ear, nose, and throat problem. And from this research, we found that 56% of the patients were on at least one prescribed medication. This is important because some medication requires frequent monitoring, for example, lithium, which is a type of psychotropic medication. And diabetic patients may find it hard to store the insulin during travel. So the most common type of medication is inhalers. 186 patients were using inhalers, and 103 patients were using steroids, 79 patients were using psychotropic medication, and 72 patients were on antihypertensives. This is followed by analgesias, antacids, blood thinners, other immunosuppressants, anti-epileptics, and other cardiac drugs. 14 patients were using insulin, and 9 patients were using other antidiabetics. As for the other categories, the most common drug is statins, in which 68 patients were using, and 51 patients were on L-thyroxine, 40 patients with antibiotics, and 12 patients with hormone replacement therapy. So in conclusion, this study provides a valuable insight into the medical profile of travelers attending a travel health clinic. The diverse range of diseases and medications reported highlights the importance of educating physicians about the specific travel health risks associated with particular conditions. And lastly, I would like to thank Travel Medicine Society of Ireland for educational grants and Tropical Medical Bureau. Thank you.